In wrapping up Mandela Month, a partnership has been formed between Ford Southern Africa and the Nelson Mandela Children's Fund to help bridge the gap in the lives of vulnerable children in rural areas where access to basic services is limited or non-existent. On Thursday, the motor company Ford handed over 19 vehicles to the Nelson Mandela Children's Fund to support its outreach efforts and to assist with accessibility of essential services such as basic health care, education or nutrition in remote rural areas. According to the Nelson Mandela Children's Fund report, more than 60% of children live below the poverty line across South Africa. However, this partnership is set to make a difference in some of those lives. So let's speak then to the Chief Executive Officer of the Nelson Mandela Children's Fund, Dr. Linda Ncube-Nkomo, who joins me now. Good afternoon and thank you for your time. So how does this partnership with Ford Motor Company and these 19 vehicles directly respond to some of these needs of vulnerable children, especially in rural areas, and thereby support the work that you do?
Good afternoon to Lasizwe and to the viewers, and thank you for having us on the show today. So what the partnership Ford Motor Company will enable us to do is to have additional mobility for the work that we do. The vehicles that have been donated to us are for use by our community-based implementing partners who we work with to ensure that we can reach children in rural areas. And we know that for the most time, children in rural areas get left behind because of accessibility. So the cars that we have been given will enable us to get to those hard to reach areas. And 3 of the cars that have been given have actually been customized cars to meet the spec of what we look for. So one of them will serve as mobile clinic, for example. And what that will do is that a child is in an area where they need to get to a clinic. As soon as the vehicle gets to them, they can already start being attended to, even as they are being transported to a place where they can get further treatment. So we know that the children we work with are multidimensionally poor. So in some instances, even the means to get them to a clinic are not there. And so this partnership will enable us to get to the children and be able to then implement the help that they need for various reasons.
For some reason, we're battling a little bit with your line and it cuts intermittently, but let's see if it improves. Let me try and take this conversation forward. So the areas that are to be targeted include healthcare, education, and nutrition. You were talking, I think, a few moments ago about these vehicles being customized to enable accessibility, and I imagine that talks to rural areas. Give us examples of areas where these vehicles will be put to use and the kind of work that your implementing partners will be able to do now that this partnership is in place.
So we will be working, like I say, really like in KZN and the Western Cape are where the majority of the cars are going to be deployed to enable then the access to the children that are in those provinces. So about 50% of our work is in rural communities. So through those implementing partners in the various provinces, that we will be able to access children that need to be vaccinated, children that need to be taken to a health facility. And I'm hoping that you are able to hear me when I say transport is an inhibitor for children getting access to medical care. So that's part of closing up the gap that we're trying to solve for.
Yeah. All right. No, thank you for that, Dr. Linda Ncube-Nkomo. I do apologize. The line did let us down here and there, and we were hearing you intermittently. I am hoping that we heard enough from that conversation with Dr. Linda Ncube-Nkomo, who is the Chief Executive Officer of the Nelson Mandela Children's Fund.